Cohort 5.0, an online national winter and spring school program, a 5-month online immersive qualitative participatory action research fieldwork certificate training fellowship. The chair for the program is Dr. Professor Vibhuti Patel, visiting distinguished professor at IMPRI, and the conveners for the program are Dr. Simi Mehta ji and Dr. Arjun Kumar ji. Proceeding further, I welcome you all to Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 5.0, and we have also shared the course outline and reading resources via email for your kind reference and attention. Before we start today's session, I would like to announce the housekeeping rule. It is important that you join the meeting on time. There will be
Did we lose Sana?
Hello. We are not able to hear Sana.
Okay, ma'am. Then I'll just complete the housekeeping rules. There will be a Q&A session after each presentation. Share your questions in the Q&A box and not in the chat box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise and refrain from making general comments in the questions to save time. Now, without any further ado, to start the session, I invite our chair, Professor Vibhuti Patel ji, to please deliver her opening remarks. Over to you, ma'am.
Hello. Yeah. So thank you very much, both Sana as well as Priyanka, for introducing the course. We are at the fag end of the course. All the lectures are over. We had a very, very renowned scholars and public intellectuals who conducted the session on all different aspects of participatory qualitative research, and also showed the effectivity of participatory research in bringing social transformation. There were sociologists, anthropologists, psychologists, medical professionals, and social activists and legal luminaries who had conducted the session. And I think we have really gained a lot from the deliberations and the intense debates that we had. We also have gone through your proposals, and at every stage, we have had interaction with you either via email or phone call or in the WhatsApp group. So now I think it's now today you are the resource persons, and you are going to make the presentation of the essays or whatever way you have chosen to make your presentation for the anthology, whether it is essay or a photo story or any other creative way of presentation of the policy issues. Because main thing is that the issues that you have chosen, they have to be of the importance to the local reality or subnational or national reality, and it should have a transformative agenda. That's the ground rule that we have. So now you can start over.
Thank you, ma'am, for your opening remarks. Now, without any further ado, we would like to move on to the program presentation, interaction session, discussion, and feedback. So, participants are requested. We request participants to kindly join as panelists, which will enable to share their presentation and unmute themselves. And we would like to start with Sujoy Chaudhary ji. Sujoy Chaudhary ji.
Good afternoon, ma'am. Good afternoon, everyone else. Am I audible?
Yes, sir, you're audible.
Yes.
Okay.
Yeah, you're
I'll start sharing my screen. Please let me know if it's visible.
Yes, sir.
Yes, it is visible.
Okay. So good afternoon once again. I would like to thank everyone at IMPRI for giving me this opportunity. I don't have a research background. This is the first time I'm, doing a research course, and I'm enjoying it thoroughly. The subject, and I selected a title for this presentation, which was about rising seas, due to climate change, and the hidden hardships. And my specific area of investigation is the sanitation crisis in the Indian Sundarbans, and how similar populations in coastal regions have been affected, and how we need a global call for action on this. So I believe there's a lot of talk, but nothing on the ground is actually happening. So this just demonstrates a picture of coastal Sundarbans, the place where I'm working. And this is after Cyclone Wash, which was not just a cyclone, but it induced tidal surges. And you can see that's how the situation is. So the next slide. My area of work, map of West Bengal, going down to the Sundarbans, and a tiny island there facing the Bay of Bengal. That's an island of about 25,000 people live out there. And I'm working in an action research mode to look at how development challenges that this population is confronted with, how we can sort of uh, develop some solutions in a participatory way, and then perhaps take this solution forward to make it adequate policy changes, and of course bring attention of the global audience to the problems that these populations are facing. Sundarbans, again, a little bit of background. There are two parts. One is the forested part. Usually people connect Sundarbans with mangroves and tigers and everything else, but there is also another part of Sundarbans, actually 104 islands, but of which 54 are out of bounds, and 50 are islands which are populated. So I'm talking about the western part of Sundarbans, which is very densely populated, has decadal growths which are higher than state, even the district growths. So it's a very and obviously the environment has been severely degraded. Now, coastal regions, this is again a picture from Moshuni, and coastal regions, where the sea, land, and air intersect. So it's a different, geography, and it's a totally different geography. Now, this is a picture of, as you can see, much of the land has already been reclaimed by the Bay of Bengal. And that's the situation. Now, my subject, while we are looking at, is a lack of access to safely managed sanitation. Sanitation is a fundamental right. And the government of India, the whole world, we are talking about how everyone in this planet should have access to safely managed drinking water and sanitation. But in this case, we are talking about how people in these communities don't have access to safely managed sanitation. And my action research would actually be trying to build a case of what happens to women who do not have access to safely managed sanitation. The whole call for sanitation was based on dignity of women first. The economic and health benefits were later, but primarily they focused on dignity of women and how we should look at it that aspect. Some of the pictures you can see, I mean, this is the condition of sanitation now, and women, obviously. Next slide, please. Yeah. So, trying to understand this situation, a few things that I'm trying to get into my research understanding. Obviously, the first is the 2030 Agenda for Sustainable Development. And the key principle of this agenda is that leaving no one behind. We all, uh, go together. No one is left behind. The Paris Climate Agreement, the UNFCCC in 2015, pledged to limit global warming. So that was the key principle of the Paris Climate Agreement. The Sendai framework for disaster risk reduction, understanding that disasters are upon us, which was hosted by the UNDRR. And that one of the key principles was that, okay, we are going to build back better. And then the Asian Ministers Ministerial Conference on Disaster Risk Reduction, which was hosted by our country. And the Prime Minister of India made a 10-point agenda where he emphasized women's leadership and greater participation. So that's a key principle of the 10-point agenda for disaster risk reduction. We also have the Disaster Management Act in 2005, and the National Policy in Disaster Management was actually developed in 2009. And that took a paradigm shift in the sense that, earlier on, we were only talking about relief, what happens after a disaster, but this was talking about prevention, mitigation, and a convergent approach. And of course, building on this, the Swachh Bharat mission and the Jal Jeevan mission under the Ministry of Jal Shakti, which again takes on this whole principle of leave no one behind. So that's in brief what I'm looking at. So in terms of progress, the abstract have been submitted and Professor Patel has approved it. So if you wanted me to go ahead. I wrote up a blog article. I understood there were some issues in the sense of maybe word limit and all. And I got feedback from the Institute on a certain few changes. I have developed semi-structured questionnaires, 3 sets. I'm looking at a group of women, I'm looking at health workers, and I'm looking at panchayat, representatives. And I had planned to go this week, but something else came up my way. So I have put that field testing for the first week of May. I've scheduled that. And immediately after field testing, I would also like to go ahead with the fieldwork for research. And I propose to submit the draft research report by the 20th of May. So that in brief is my presentation for today. So I'll be glad.
Yes, Mr.
Yeah.
Yes, Mr. Sujay Chaudhary, you have brought out very important aspects of both epidemiological concern and the WASH issue and linking them both with the global goals and the national agenda. Only one missing thing I see is the safety that you have not linked, because it's a WASH is so much linked to safety, so many, most of the, even in bastis and all, highest number of gender-based violence and sexual violence takes place because of because of absence of facilities. Even in that cinema, Akshay Kumar cinema, it has shown that. So safety, I think you should include that as, and there are enough studies also for your reference.
Yes. I definitely would include this. I also would like to mention that while trying to do literature review of studies on women and lack of access to sanitation, there isn't much literature covering the Sundarbans part, at least. There are a lot of studies in Bangladesh where it is slightly different, demographically also different. But India, unfortunately, we don't have much studies on the impacts.
Only on the urban studies are there, like Right to P campaign. They have done studies. In fact, the thesis of Supriya Sonar is also on WASH. So that World Bank studies are there. Rural, no.
Women, it's not there. anyways.
You are right.
So I'll
right.
definitely include the safety issue. I'll definitely do that. Any other suggestions, ma'am?
No, otherwise it's a good one. Yeah.
Thank you. Thank you, ma'am.
Excellent. And the use of these maps and showing the topography and the whole geographical location and the specificity of Sundarbans, that's very important because that will go in the introduction.
Yeah.
And it also enhances the understanding of the readers.
And may I just add, since this is part of my the work that I'm involved in, and having gone through a lot of the at a global level, there is still so much work missing on defining indicators, whether it is at the SDG indicators. In India, we have the National Index Framework, which is an adaptation of the SDG. Yeah, and then how some of those indicators are not they are not nuanced. They're very generalized.
Very general.
Kind
and
of
when
thing.
it comes to
And
gender,
women
it is
somehow,
they are totally insensitive. Yeah.
Yes, absolutely. So, and Russian women, absolutely nothing. I mean, so I'm trying to take that work forward also.
So I think work on menstruation by the women's organizations, recently several studies, even the Sulabh has come up, Sulabh International has come up with a voluminous report, multicentric study of 8 states.
Right.
Which is also very exhaustive. That also links it to the question of dignity as well as safety.
Absolutely.
Yeah. Have you seen that study?
No, I haven't. I'll check it out.
So should I share it in the
Oh, that'll be
WhatsApp?
fantastic. That'll be fantastic, ma'am.
That is our.
That'll be fantastic. Yeah. All kind of materials, national studies, I think is going to help me take the case forward, because right now I have been discussing with the Jal Shakti representative at the state level, which is the mission director. And it seems that this will have to be taken up to the Ministry of Jal Shakti, because the provisions, I mean, where there are policy gaps as well as no funds. The adaptation funds are missing. So, and then the whole issue about DRR, is it just in name? And DRR, disaster risk reduction, the indicator for that is also at the global level as well as the national level is yes or no. Does the country have a strategy? Yes, it has. And local levels, do they have a strategy? Yes, but it's not about what happens to that policy in place. So, is it being used? Is it helping out? So I think there's a lot of work I would like to pursue in the future with this.
Do we have WhatsApp group of this cohort?
Yes, ma'am.
Priyanka ji, what is the what is it called?
Yes, ma'am.
What is the WhatsApp group's address?
I'll just try to put it on the chat box. It's PPQARF 5.0. Do you want me to put on the chat box?
Yeah. So then I can share it right away. It is there on
that
report. Multicentric report is there.
Right. Thank you, ma'am.
Even yeah.
Right. Stop sharing.
Congratulations. Yes.
Thank you.
Thank you, sir, for your presentation, and thank you, ma'am, for your remarks. Now, moving forward, we have next presenter, Santoshi Tyagi ji.
Santushti, yes. Do I share my screen?
Yeah.
Yes, please.
Just a second. Is my screen visible?
Not yet.
1 second. Is it visible now?
Yes, yes, now it's visible.
Yes, so ma'am, for my creative project, I have made a short documentary of my groundwork and qualitative research. Before I begin it, I just want to give a quick brief about it. So, this documentary, for my qualitative research, I have gone into the slums of Ghaziabad to interview women from the lower economic groups. And while in conversation with them, I talked about certain government health policies, namely Ayushman Bharat and ICDS mainly. And while I was in conversation with them, there were a few loopholes that were quite common to each and every person that I interviewed. Um, during this course of during this following the following minutes of the documentary film, they talk about how financial restraints and bureaucratic hurdles and the lack of awareness of these policies continue to be a major problem while their accessibility to these government policies. So please allow me to play the documentary on the screen. I grew up in Ghaziabad, a city that is full of life and aspiration, like Prem, Lakshmi, Savitri, and many other women that you'll meet in the next couple minutes. But whereas my path was guided by choices, theirs is a journey of challenges beyond our comprehension. Challenges to reach even the most fundamental human rights: water, healthcare, education, things that we usually take for granted. Here, development is paradoxical. A kilometer from here in the same city, change communicates differently. It's modernity and advancement to some, but an illusion to others. A promise yet to ring their doors. How do we connect this divide in a city that has the same heart beating but different lungs breathing?
मेरा नाम लक्ष्मी है, हम बाला जिला से हैं। काम हम यहाँ आके गाजियाबाद में करते हैं, झाड़ू पोछा बर्तन। वो ऐसी है कि चाहे इधर सुना तो हमारी सुनाई होती नहीं है, वहाँ सुना तो नहीं सुनाई होती है। कमाना खाना हमें है ही नहीं। बताओ, गलत कहती हूँ तो बताओ। हाथ पांव चला रहे हैं तो खा रहे हैं, नहीं हमें कौन मिल रहा है? गरीब आदमी।
आप हिंदी पढ़ना जानती हैं? मैं कुछ नहीं जी, तो मैं आपको बताती हूँ। इसमें लिखा है आटा 5 रुपए किलो मिलेगा, नमक 10 रुपए किलो, चीनी 10 रुपए किलो, दाल 10 रुपए किलो, बेसन 10 रुपए किलो, तेल 70 रुपए किलो, हल्दी 10 रुपए किलो।
पैसा तो बेकार करवा दें। वो 5 लाख रुपए कहाँ से मिल जाएंगे हम लोगों को? बताओ तुम। जो बड़ी बूढ़ी ने 60 साल की पेंशन में ले ना, वो 1500 रुपए पेंशन में तो बेकार करवा दे। तो मुझे 5 लाख रुपए तो बहुत होते हैं। बताओ, महीना में 500 रुपया महीना की पेंशन, 500 की, बताओ वो पेंशन कटवा दें। बहुत दुखी, दिल धक्के खा के मंदिर पे बैठ तो मेरी तबीयत अब मैं बिना तो सब खा लू मेरा मैं बैठ के। और कभी डॉक्टर के पास जाऊंगी, प्राइवेट डॉक्टर के पास, सरकारी में ना जा पाती मैं। क्यों? अब दूर ज्यादा हुआ है तो मैं कैसे चला, मेरे से जाता नहीं। तबीयत तो बहुत परेशान हूँ मैं। अगर यहाँ से फाटक तक जाऊंगी ना, 4 जगह बैठ कर जब जाऊँ तो मेरे से चला ही नहीं जाता, तो मैं कैसे जाऊँ? दूर है, भला हम पहुंच ही ना पाते वहां तक। कहाँ है हमको यही पता नहीं है कि कहाँ है। बहुत दूर पर है ना, तो वहां तक जाते जा नहीं पाते, तो फिर प्राइवेट से लेते हैं दवाई। तो कोई आव भी है तो महीने में एक दफा में है 1 किलो चावल होगा, 1 किलो आटा होगा, बस 250 ग्राम दाल, वो भी केन दे जा केन नाती बस। ये तो आशा के रवा की सब झूठ बात है। जाते माता सब बता देंगे कहाँ से आ गई ना कोई ना आवे। अब तो पहले तो आ जाए, अब तो टीको लगाए बिना आवे बच्चे ना के। अब नाम क्या ऐसा खासा कोई कुछ फायदा नहीं हुआ इसका। वो न्यू करे थे, हमारा राशन कार्ड बन जाएगा इससे, और तुम्हें इससे राशन मिलेगा।
आप कहाँ पे गई थी ये कार्ड जहाँ पे आपका बना?
यही बड़ा था।
अच्छा, यहीं आए थे?
पेड़ के नीचे बड़ा था।
इस नंबर पर इनकमिंग कॉल की सुविधा अभी उपलब्ध नहीं है. The incoming call facility to this number is currently not available.
जी, ये जो नंबर इसमें दिया है इस पे मैं मिला रही हूँ, तो ये कह रहा है कि कॉल बंद है. ये सर्व समाज विधवा कल्याण शिक्षा सेवा समिति से किसी अनुज ने कार्यकर्ता के हस्ताक्षर करे हैं और इसमें लिखा गया है कि आपको 12 महीने हैं. इसमें आटा, नमक, चीनी, दाल, बेसन, रिफाइंड मसाले मिलेंगे. जब जब ये मिलता तो यहाँ लिखा होता, पर उसके बाद कोई आपके पास आया नहीं. जून 2023 का है ये. तब से फिर कोई काम नंबर मिल नहीं रहा है. ये नाम पता आपका है, साइन भी हो रखे हैं, बाकी सब इसमें है. दुकान संख्या 7 भी लिखी है, कार्ड संख्या भी है, तो वो तो सब है पर मिला नहीं है. ऐसा हो रहा कि कहीं जाकर अपने आप में अच्छा कर लो.
Ma'am, that was my creative project for the qualitative research.
But are you drawing the policy list? Because that is important.
Sorry, ma'am.
What are the policy imperatives that you are suggesting?
Yes,
that
ma'am.
also should be there in your creative
Yes,
project.
ma'am.
Yeah.
Yes, ma'am. Like I need to add it in towards the end of it. Okay.
Because this is a qualitative research has to now, result in this. Yeah.
Ma'am, all of that is mentioned in my while I'm writing the chapter, so it could not be incorporated in the documentary as such as a creative project, but I've written it all down in the chapter.
But even in documentary, you may not have voiceover, but at least you can end with this, no? As they do in so many cinemas and feature films as well as documentary films, no? What is required? Yeah, that you can see. Otherwise, it's fine. Yeah, yeah. Congratulations. That's good. You have completed review of literature?
Yes, ma'am.
Okay.
Ma'am, actually, when I was going through the relevant data that is available, I came across certain researches that have been done in the state and specifically in the city, but there were no such. The questionnaire that I developed for my this qualitative research, I tried to incorporate questions on Ayushman Bharat and Janani Suraksha Yojana and Integrated Child Development Scheme. And when I was in conversation with these women, talking to them about their accessibility, trying to understand the impact that these have, there were a few more questions that branched during the conversation, and most of those came down to the fact that these people have their Aadhaar cards and everything ready, but they are not able to access the healthcare and also the 5 lakh rupee that comes in the account under Ayushman Bharat scheme. So they are not able to access it due to certain common issues. That is, it is too far, either the hospitals are too far, or the documentation work takes a lot of time, or most of the time the ashas tend to leave that place after coming for a couple of visits. So that is specifically covered in.
You have gone through the Charter of Demand and the memorandum and all this by the ASHA workers. Have you? Yes. And Jashodhara Dasgupta's article? Yeah.
Thank you so much for such an insightful presentation. It was very inspiring, and thank you, ma'am, for your remarks. Moving forward, we have presentation of Janavi. Ma'am, we have the recorded presentation of ours.
Yeah.
Good afternoon, everyone. I'm Janvi. Today I'm going to share my journey of doing this research. So the title of the research was A Qualitative Exploration of Rural Women's Access to Family Planning Services in India. The study was based out of Hajipur, a block in the Vaishali district of Bihar. So the research was carried out in 6 panchayats of the Hajipur block. I did 30 in-depth interviews, and the goal was to understand the real barriers women face in accessing family planning services in India. So these were the voices of the women that whispered truths which we must turn into the action. Despite decade of policies, rural women, especially in Bihar, struggle to access family planning services is really critical. I wanted to understand the why of it. So I went to Hajipur block and spoke to 30 women across 6 panchayats. These weren't just health issues, these were power issues, social issues. I remember one woman said, I took pills whenever I remembered and still got pregnant. The system assumes knowledge, but women are surviving on guesswork. But women aren't passive, they resist in small, courageous ways. They hide pills inside a painkiller, inside their uh, painkiller wrappers, and save rupees 10 a week to get those medicines for there. So women are doing efforts on their part, which is hiding contraceptive, saving secret saving to travel to health and wellness centers to get those medicines. So what we need to do, train ashas and improve their supply chains, create male engagements and family dialogues, ensure privacy and dignity in care, and link family planning to economic empowerment. The most important is we need to talk about it openly and break taboos. So I wrote a small poem. In the fields where mustard blooms with pride, walk barefoot mothers with dreams denied. Children clenching, mouths to feed, yet no one asks what they need. A pill, a word, a little say, a chance to space their births delay. But husbands rule and mothers-in-law stare, and temples echo with sons as prayer. She hides her pill in a box of balm, saves 10 rupees with practiced calm. She smiles through fear, through side effect pain, her silence thunders loud and rain. The health post shuts before she's free. No transport, no wage, no privacy. She walks back home with stories untold of how free care costs too much gold. Yet listen close beneath the hush. There's a revolution in the rush. In every whispered no more child, in every Asha's walk that smile, there is no tale of helpless prey, but of quiet warriors finding a way. So bend your ears to what they say and build a world where they can sway. Thank you so much.
So this is your creative project. Are you also going to make uh, submit an essay? Hello? Acha, she is not there. No?
Ma'am, actually
Yes,
it was
ma'am.
Yeah. Priyanka ji, what has she said?
Ma'am, yes, most likely I think they'll be submitting the research paper also.
Yeah, so this can also be part of it. Very poignant and very touching. She has grasped the issues also because 30 interviews she has conducted. So it's a lot of interesting and useful and educative policy imperations. Then build the evidences, which are useful for policies.
Thank you, ma'am, for your remarks. Now, moving forward, we have a last presentation of Shubhana ji.
Yeah, can you hear me?
Yes, ma'am, you're audible.
Yeah, okay. So, should I screen share?
Yes, please, ma'am.
Yeah. Sure.
Priyanka ji, can you just play my PPT, please?
Yeah, sure. Just give me a second.
Ma'am, I'll just start, like, let her, get the PPT ready. So my topic is road connectivity and rural transformation. This I'm going to do through assessing the impact of Pradhan Mantri Gram Sadak Yojana, which was launched in the year 2000. So this year marks its 25th year of presence, and we have seen a lot of policies that focus on rural urban, to fill the gap, to fill the urban fringes. This is one of those, but this was launched way back in Vajpayee's era. And this rural policy has been ongoing for 3 phases now, ma'am. So now I'm exploring the third phase, and I'm doing this in the district of Tiruvallur. I've selected two panchayats actually. One is Kuttambakam and other is Nemam. And why these panchayat is because these two panchayats form the rural fringes of Chennai actually. Rural fringes, by which I mean they're really close to the main city Chennai, but they lack all the facilities and the development which Chennai has. So how does these rural road connectivity help them in things such as, can you go to the next slide, please? Like how it impacts them in socioeconomic development, migration trends, and local economies. So these are the three things that I want to focus on. And the methodology that I've adopted is both. It's a mixed approach actually, primary data collection and secondary data collection. For primary, I've actually met around 50 to 60 respondents who are willing to say their opinions on these road infrastructures or the policies which they use daily. But what are all the problems that they face, or what are all the impacts, positive and negative, that has come across in their life? So the current phase actually, I'm doing a structured surveys and interviews, and I'm also wanting to talk to the panchayat presidents because they are the people who take this policy to the ground level. Though it is a centrally funded project, they come to the people of the local through these panchayat leaders, which I'm actually currently finding it really difficult because they refuse to give data, or like they don't want to talk about the in-depth how it functions and all of that. So that is on process, ma'am. And the next thing is, I want to see the major objectives and goals of this project, of this policy, is to create an all-weather road connectivity and to connect the villages which are unconnected to the cities, mainly to improve urbanization, to healthcare, to administrative services, to enhance their access to markets, basically. So, doing all of this, they have forgotten the sustainable reasons that has to be incorporated along. So those are the factors that I'm looking into right now. And there is also a severe urbanization which is happening, which is actually demeaning the rural practices of those places. Now, these projects have also started to incorporate the other policies such as the SPMRM or other policies which also, enhances rural areas for their sustainable growth. The next thing what I would like to see is that their impact on urbanization, road connectivity and urbanization definitely play a very major role. And it also has majorly impacted their migration patterns. As far as I've spoken with the respondents or the people of those two particular panchayats, they feel that the more these road connectivities are enhanced, they want to move out of their places. They want to go and stay in the cities and maybe travel, have this, temporary migration that goes in the morning, come back in the evening. So this has left the urban areas, all the rural areas, actually, there is a vacuum that is created. They don't want to, find a way to settle here or enhance. Rather, their movement to the cities has made it even more possible for them to drift them away to the cities. So this is one of the setbacks that we face in this project or in this policy, basically, because this is not an umbrella project which has actually foreseen what could be the negative impacts of this. Road connectivity, of course, has enhanced various sectors like medicine, employment, children's going to college, schools, and everything. But their liking or their need to stay back in the rural fringes or in their panchayats and to improve them has drastically reduced. So my survey is still ongoing, ma'am. Actually, I'm yet to talk about, I'm yet to interact with them about their economic growth and impact. Um, and how it's impacting their day-to-day migration patterns even more. Those are the two things that I need to talk to, and I'm waiting upon 2, 3 panchayat presidents' appointments as well. So after I get done with all of that, I'll get a better picture, ma'am.
I think two more aspects which need to be included is one is reduction in maternal mortality, child mortality, some of the health emergencies that women face. Because the moment you have road, it improves. Because
Yes, ma'am.
four-wheelers come, three-wheelers come, they can be taken, they are not taken. Recently, we heard last week how
Yes,
that
ma'am.
elderly lady who fainted in the field, they did not have road connectivity. They took up to 18 kilometers, they took her up to. Poor
Yes,
people,
ma'am.
the neighbors, they took and she died on the road. So I
Yeah.
think one major thing is that the health emergencies can be eaten. So the mortality rate goes down, especially women, pregnant women and children. So that is very important. And number two is the drudgery reduction. Because even I saw the public recently where the 1,200 kilometers of road is coming, has been uh, uh, and which planned and executed also. Phase one is over. The most difficult and unapproachable areas of Maharashtra. The what they said that it also gives them reduces the treasury and also opportunities for petty trade and all. Once you have road, you are connected, and that we saw even in Delhi, after
Yeah, ma'am.
connectivity and mobility. So those aspects also you need to bring.
Ma'am, one certain aspect that they are facing severe downfall is the maintenance of the roads that have been laid years back. So there is also this state and center rift asking as to who has to maintain it. So these small problems and all of these, unsaid rules that are followed between these federal systems, that also plays a very huge role. And these roads are like left damaged; they are not taken care of. So it promotes even more of a chaos actually there. So that is also one point.
No, but wherever they want, wherever they like, I was in Sikkim, there was a landslide.
Yeah,
Within 12 hours, roads were okay. They employed the army in there. So when it is a question of operational issue, that if
exactly,
there is
ma'am. Yeah,
a lethargy and political this thing, so those are the issues that need to be dealt with by politicians also, and the
yes,
governance
ma'am.
structure. That too
Yeah,
we need to be alert about. But
exactly, ma'am.
when it is not that resources are not there. Resources
Yes,
are
ma'am.
there, but political will is very important. Because
Yes,
see,
ma'am.
whenever the prime minister or any leader comes, immediately roads are excellent. Within 24 hours, you could see.
Exactly,
We have
ma'am.
seen in our universities also,
Yeah,
all that
yeah, yeah.
very dilapidated infrastructure. Within 2 days, it becomes this thing. All the resources are applied for that, and you have everything, whether there are broken steps or lift not working or all the electricity wires hanging, everything disappears, no? Because
Yes,
you
ma'am.
know that there is going to be the accountability. So accountability has to be increased. And for that, both the pressure from the civil society organization, more accountability on the part of the administration, and also empowerment of local self-government bodies, rural as well as urban. Yesterday was a Panchayati Raj day,
Yes, ma'am.
day before yesterday, and all these women are saying that resources are there, but it is mainly they are panchayats are starved. So I think those kind of policy recommendations would be very good, because they are the first first contact point.
Exactly, ma'am. Yeah.
Panchayats are the first contact points, and empowering them. When you talk about political decentralization, it has to be accompanied by the funds, functions, and functionaries.
Yes, ma'am. Yes, ma'am.
Yeah, so I think so connect your,
Yeah.
otherwise your work is very good. And
Thank
you
you, ma'am.
have done also extensive fieldwork, but analytically, I think you make
Yes,
it
ma'am. Yes, ma'am.
robust.
Sure, I will do that, ma'am. I'll do it.
Yeah.
Thank you, ma'am.
So we got 4 states, Sundarbans and Tamil Nadu, and this thing. So variety of experiences.
Thank you.
Thank you for your presentation and thank you, ma'am, for your remarks. We have one more presentation by Ananda ji.
Yeah.
Screen is visible.
Yeah. Okay. So welcome. So still I'm struggling to like the professional work. So that's why I'm bit late to present and share the all of the requirement of this course. But definitely I joined all the courses, classes by the expert. Before that, so submitting all the things, but I'm choosing the area and topic for this conduction of the research, and I'm very much passionate to do the research work on the climate change and child rights violation. It might be the new things for the Bangladesh because we are the country in our coastal belt. People are suffering from lots of climate change, natural disaster and hazards. So child is the one of the major minors, so certainly they that's during the cyclone period, so child rights violation is observed. So that's why I'm choosing this topic. So my topic is climate change and child rights violation, a qualitative research in Bangladesh coastal communities. So it's focused on completely the coastal communities, and definitely the participatory research approaches I will follow. So I chose the two research objective for this research. So first thing is to identify the experiences and the practice and perception of the NGOs, then government officials, teachers, and the parents, how the climate change related with the child rights violation. So it's mostly what they believe about the climate change, how they impacted on the child rights. So mostly people are in Bangladesh. So before that, I'm joining in the Cox's Bazar. So I don't have any idea about the child protection, child rights, or something like that. So in the mainstream, in emergency or refugee context and the mainstream, there is far difference between the knowledge about the child rights and child protection. So that's the first objective. And second objective to how to determine the coping strategy of the local community, and generate some recommendation for the government and stakeholder for protecting the child during the crisis, mostly the climate change issue. And definitely I also suggest some local indigenous practices based on the findings, how to protect the children in any certain circumstances based on the climate change or natural disaster or any hazards. So study location Shyamnagar, Satkira, very close to the Sundarban, and it's one of the impacted area based on the climate change. So that's why I chose that one. So I in my university age, so I frequently visited there to collecting the data and to prepare the assignment in 2016 and 17. So throughout the 7 years AO. So I have that experiences, but right now I choose that one because I have the connection with the NGOs, and there are lots of NGOs are working on there. So that's the thing. The sample size initially is the completely the purposive sampling procedure I will choose, and the 10 NGO worker because there are lots of NGO are working there regarding the climate change. Then two officials, government officials, this might be increased 2 or 4. So and teachers too, because teachers is the primary guardian in the school system. So how to the education system can be protect the climate change issue and the and increase the community level of the child rights violation, child rights, and something the knowledge about that part. And definitely the parents of 6, 3 female mother and 3 from the male. So that's the total things. But I'm sorry, Professor Bibhuti Patel, so I'm not submitted anything. This is my raw idea, but within 2 to 3 days, I will definitely finish all the things. So please, my apology to allow me to conduct that one. So hopefully during the deadline, I will submit all the things. But in prior, I'm promising to meet the deadline, but due to my official engagement and some project closing issues, so I'm not focusing on the research on things, but I get the knowledge from the classes. So I utilize that one and share within this week all the things, all the deliverables. So please allow me.
Yeah, okay, but you have not gone through the process of proposal and then discussion on that. And so now you will send the final, you say that you'll send the final essay and your creative presentation. How do you want to go about it?
Ma'am, if you allow, so today I will share the abstract, and if you allow, then I will share by this week to blog and the proposal, like the questionnaire and the piloting testing. So within this week, if you allow, like today is 26th, so I will share all the things by 1st May. If you allow, so all the things I will, and then your guidance, feedback, I incorporate that feedback by 5th. I will reshare, and when you allow to conduct the interview, then I will start to interview with the stakeholder and to prepare and analyze the data and share with you within the deadline. So if you allow, ma'am.
Yeah, that is fine.
Thank you, ma'am.
You have the guideline and the style sheet, no, with you. Yeah.
Yes.
Because we have shared that by PDF. That is fine. Yeah.
Okay, ma'am. Thank
now
you.
stick to deadline so that the anthology is not delayed. Others have done it. Yeah.
Okay. Thank you so much for your allow.
Yeah.
Thank you, sir, for your presentation, and thank you, ma'am, for your remark. With this, we are done with presentations today, and thank you so much, ma'am, for your comprehensive and encouraging feedback on all the presentations. And a special thanks to all the fellows for sharing the excellent work, and it was truly a meaningful learning experience. So this brings us to the end of this program today, and now I invite our chair, Professor Vibhuti Patel ji, to share, to deliver the closing remarks for today's session.
Yeah, I think I'm quite happy that the way all the proposals and the extended proposals and the overall discussion about the essays and the presentation by the fellows has been made, because resource persons, they put their heart and soul into it. They gave the brilliant work, brilliant sessions based on their personal involvement in participatory qualitative research. They are one of the topmost policy researchers of our country. And we also got the interdisciplinary, transdisciplinary, multidisciplinary, and intradisciplinary perspectives from the presentations of all our resource persons. On behalf of IMPRI team, we express the heartfelt thanks to all the resource persons who have always been with you, and we have been able to successfully conduct the course. Even previous 4 cohorts, they were result oriented, and I'm sure this course is also going to come up with a very good anthology and creative presentations. The whole process was very good because of the interactive, lot of space given. There was a democratic space, so the atmosphere was very secure for intellectual endeavor, and some of the creative ideas that were trashed out in the discussion. And even the WhatsApp group has been very helpful. We have been sharing resources, intellectual resources, whatever experiences that we have been shared. And I'm sure this collective endeavor will have a very nice result also. So I express my best wishes to all of you for completion of your essays, as well as whatever way you want to express yourself so far as the qualitative participatory action research, which results into evidence-based policy intervention. Thank you.
Thank you so much, ma'am, for your closing remarks. With this, I would like to proceed to form a vote of thanks. As we come to the end of the Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 5.0 and Online National Winter Spring School Program of 5-month online immersive Qualitative Participatory Action Research Fieldwork Certificate Training Fellowship, I, Sana Ansari, researcher at IMPRI Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI New Delhi. We are grateful for our chair, Professor Vibhuti Patel ji, for taking out her valuable time and providing thought-provoking insights on the topic. We thank all our participants who have presented today and raised important questions and actively participated in today's celebration. Reading for the session has been shared in your email, and video of the session will also be shared for your future learning. As today marks the last day of the program, we are deeply grateful to all our experts who have shared their valuable insights with us. Participants are kindly requested to note that feedback forms will be shared with you all via email. Participation certificates will be issued after the feedback forms are submitted, so kindly take note of this. Lastly, a gentle reminder that the deadline for essay draft submission is on 3rd May. We are grateful if you're watching us later on YouTube or listening to us on various podcasts or reading our publication. We hope you continue to join in the future IMPRI event as well, and Web Policy Talk and Web Policy Learning. Wishing a very good evening. Thank you so much.
Thank you, Sana, for anchoring the whole course so beautifully.
Thank you, ma'am.